Hi everyone. In this class, we are going to deal details about the mammary gland. So before going into the detailed description of this particular gland, we will just look for its orientation in human body, how it will be arranged. So if you are taking mammary gland as you are seeing in this picture, you can make out this yellow colored area that whole consists of fatty region which we will call as mammary gland, and this mammary gland, if you are seeing, it is located bilaterally on either side of the body. It will be seen both males and females, but in males it will not be developed much. In females it will be well developed, and it is rudimentary in males. And if you are seeing into the internal feature, you can make out some lobes present in the mammary gland, and these lobes, again, it is going to give out the secretion into a duct like formation which we will call as lactiferous duct, and this lactiferous duct at last terminating into a dilated part which we will call as lactiferous sinus, and this sinus later ends up in the nipple region to give out or pour out the secretion out. So this is about the internal feature of mammary gland, and you can make out green vessels or green tubes present all over the mammary gland, and these are nothing but lymph vessels. So lymphatic system is well developed in mammary gland to drain out the lymph fluid. So if you are taking about the lymphatic system of mammary gland, again I will make you learn detailing. Just for now, we will be having lymph vessels draining into the lymphatics or lymph fluid draining into the lymphatic vessels, and these vessels at last going to terminate or pour out the lymph fluid into the nodes surrounding this mammary gland. Surrounding the mammary gland, we will be having many important lymph nodes which is going to drain all the lymphatics from the mammary gland, and about the detailed description we will deal later. And then you can make out a muscle present just behind the mammary gland. That muscle is nothing but pectoralis major. As you already know, this mammary gland, it is seen in the pectoral region in the superficial fascia. So after you remove this mammary gland, you can make out pectoral fascia which is covering the pectoralis major muscle, and once you dissect that fascia also, you can get into the muscle called pectoralis major muscle. The importance of muscle present behind the mammary gland we will deal, or I will describe it later again. Then we'll be seeing some other features, such as we'll be having cross section of the mammary gland. So about the cross section of mammary gland, as you are seeing here, we will be having again fat present all over the mammary gland, and if you are taking from layers, outer layer we will call as skin. Below that we will be having superficial fascia, which is nothing but modified sweat gland, which we are learning now, that is mammary gland. And then below that we will be having another layer, that is deep fascia, which is not demarcated here. You just remember, we will be having pectoral fascia just below the superficial fascia or mammary gland. Later or deep to it, we will be having a muscle part. The thickened muscle which we have just below the mammary gland is nothing but pectoralis major muscle, which you are seeing here. Then if you are seeing in cross section, you can make out clearly we will be having lobules present. So these are the gland lobules which is going to secrete the milk. Later this secretion are going to get into the duct. So the tubes you can make out here, that is nothing but lactiferous ducts. So these ducts at last end up in a dilated tube. So this tube, it is ending up in a dilated part. That dilated part we will call as lactiferous sinus. So this is the area where the secretions will be filled out and present. When the breastfeeding persons, during milk ejection, it will come out through the sinus into the nipple region. So this is the nipple part which is surrounded by areola here. Later we'll be having glandular tissue which you are seeing here now. So that's all about the details of mammary gland which you have to know for orientation purpose. Now we will get into the topic of mammary gland detailing. So now we are going to see the detailed description about mammary gland and their important features. So in mammary gland, the things we are going to cover in this topic are such as extent, features, relation and structure of mammary gland with its blood supply, nerve supply along with lymphatic drainage and their development along with applied aspects. These are the important objectives we are going to cover in mammary gland. Now, in breast, you have breast which is arranged bilaterally on either side of our body, which will be seen both in males and female, but in female it is very much developed. So it is considered as accessory female reproductive organ, and it is also known as modified sweat gland. And so it will be having fascia which is giving rise to this mammary gland. As you already know, we have some layers present in our body. As I said before, in superficial fascia we have this mammary gland, and in that where particularly it is present in the pectoral region. It has no distinct fibrous capsule present in it. So about mammary gland, these are the important things you have to note it down. And this accessory female reproductive organ, and it is a modified sweat gland, and it is also present bilaterally in the superficial fascia of the pectoral region, and which has no distinct fibrous capsule. Now coming for the extent of this mammary gland, which we are dividing both in vertical and horizontal level. So in vertical level, if you are taking in anatomical position, and vertical extent of this mammary gland is counted by its ribs. So we have 12 ribs altogether. So in this, the mammary gland is situated between the second to sixth rib, and it is calculated in the mid-clavicular line. So mammary gland extend vertically from second to sixth rib in the mid-clavicular line. As you can note it down in this picture, so this rib is considered as second rib, and the rib which is present in the lower part, which will be called as sixth rib. So these are the 5 ribs which is going to be related to the mammary gland. Now coming for horizontal extent. So talking about horizontal extent, it is extending from medial to lateral. So medially it is extending from lateral border of the sternum. You can make out here we have sternum, and from the lateral border of sternum to the mid-axillary level. So in this picture you can make out here, this is the axillary region, and from this axillary region we have mid-axillary line. So from the mid-axillary line we have lateral extent. So medial to lateral, that is horizontal extent from the lateral border of sternum to the mid-axillary line, which is present along the 4th rib. Now talking about a tail, which is extension of this mammary gland. As I already said, we have an extension from mammary gland which is outgrowing laterally. So that tail is called as axillary tail of Spence. You can make out in this picture, and this axillary tail of Spence is nothing but it is going to enter the axilla through an opening present in the axillary fascia, which we will call as foramen of Langer. It is a tail-like projection which is extending from the mammary gland to the axillary region by passing through the axillary fascia and the opening, which we will call as foramen of Langer. This thing is an important thing you have to remember. Then the importance is that it is having contact with axillary lymph nodes. Axillary lymph nodes, if you take, we will again divide this axillary lymph nodes into 5 parts. Among that, the anterior group of axillary lymph nodes will be related to this tail of Spence. So axillary tail of Spence, how it is passing you have to remember. Then after, how it is related to lymph nodes you have to mention. So this axillary tail of Spence, it is entering into the axilla through the foramen of Langer, and it is having contact with anterior axillary lymph nodes. That's all about axillary tail of Spence. An important clinical aspect about this is sometimes it is mistaken for lipoma. If this axillary tail is enlarged, some people will mistake this as a lipoma, which is a wrong decision. And then we will be seeing about the features or relations seen underneath this mammary gland. So we will call collectively as mammary bed, which is nothing but relation seen below the or in the posterior aspect of mammary gland. So this mammary bed structures are three muscles. One is pectoralis major, which you are seeing here. So pectoralis major muscle, then we have serratus anterior in the lateral aspect, and then we will be having external oblique aponeurosis in the lower part. So breast lies on deep fascia, which is covering the pectoralis major muscle, and this base of breast rests upon, so breast lies on the deep fascia covering the pectoralis major, and this base of breast is formed by three muscles, especially pectoralis major from above, and then we will be having laterally serratus anterior, and in the lower part we will be having external oblique aponeurosis. So these are the structures which is going to form mammary bed. So between the mammary bed, that is between the muscles and this mammary gland, we will be having a small space which we will call as retromammary space. You might know retro in the sense it is indicating posterior aspect. So retromammary space is a space present just behind the mammary gland between the muscles and the mammary gland. So if you are seeing about retromammary space, it is nothing but having loose connective tissue. The space which have loose connective tissue between the gland and the pectoralis major muscle, and then the breast which is moving freely because of this retromammary space. As we have this space, the breast can be moved freely over the muscle called pectoralis major. So then we will be seeing about the clinical aspect caused in this retromammary space. If a carcinoma is occurred, this retromammary space will be fixed to the muscle present behind. So the invasion of breast carcinoma causes the gland to get fixed to the pectoralis major muscle. So now we are going to see about the structures present in this mammary gland. So to talk about the structure of mammary gland, we will divide it into three sections, such as we have skin layer on the we have second one as parenchyma, and then we will be having stroma. So these are the three important structures we are going to see in mammary gland. So three layers such as skin, parenchyma, which will be having glandular tissue, and third aspect will be stroma, which will be carrying fibrous and fatty tissues. So now talking about skin. So skin, if you take, you can make out the features such as nipple and areola. So these are the two important features which you will see in the skin of this mammary gland. So you can make out here the skin of the mammary gland is having nipple at just below the center of the mammary gland, and then it is surrounded by a darkened area that we will call as areola, where all the ducts are going to terminate. So above skin, if you are seeing, we will be having features such as nipple. So nipple, it is nothing but a conical projection, and then below it is present just below the center of the breast. Nipple position, if you are seeing, it is not in the center, it is just below the center of the breast, and it is present at the level of fourth intercostal space in nulliparous female. You might know nulliparous in the sense the person who have not given birth yet. So we will be having nulliparous females where the level of the nipple will be seen at the fourth intercostal space, and it is an erectile tissue which is richly supplied with nerves. You can make out it will be having erectile tissues which will be having rich supply of nerves, and it is also pierced by 18 to 20 lactiferous ducts. So piercing this nipple are 18 to 20 lactiferous ducts. It is having both circular and longitudinal smooth muscles. Circular muscles, it will cause the muscle to erect, and in case of longitudinal muscle, it will retract the nipples. That's all about the features seen in the skin, that is nipple region. So nipple, it is nothing but conical projection, and the level of nipple is present just below the center of the breast. And if they are asking for the level exactly, you should tell it will be seen in the fourth intercostal space. And about the tissues, how it is arranged, it is an erectile tissue, and it is also having rich nerve supply. And you have to remember, it is pierced by 18 to 20 lactiferous ducts, and it is having two types of muscles present in the nipple, such as circular and longitudinal muscle, where circular muscle causes erects, and then we'll be having longitudinal muscle which will retract the nipple below. So that's all about the nipple of the skin. Then we will be having another feature, that is areola. So this, as I said before, in skin we are going to talk about only two important features. One is nipple and the other one is areola. So nipple got over, now we are going to move to areola. So in areola we will be having features such as, it is a pigmented circular area of skin which is present around the base of the nipple. So the thickened part which is seen just behind the nipple surrounding in a circular manner we will call as areola. The outer margin of this areola contains modified sebaceous glands. You know, whole of the mammary gland itself is a modified sweat gland. In that we will be having areola, lateral margin, it is having modified sweat glands. The thing you have to remember, sweat gland, modified sweat gland is mammary gland, modified sebaceous gland will be seen in the areola's outer margin. It is enlarged during pregnancy and lactation, and so because of the enlargement seen in the outer margin, that is in the modified sebaceous gland, those enlargements are called as tubercles, and we are giving a special name for it, that is Montgomery tubercles. So Montgomery tubercles are seen in the lateral margin or outer margin of the areola, which is seen clearly during pregnancy and at the during time of lactation. You can make out in this picture clearly. So Montgomery tubercles which are seen in the areola, and these Montgomery tubercles are going to give some oily secretion which is used for protection and also for lubrication. And then the skin of the nipple and areola are devoid of hair and subcutaneous fat. This is an important thing you have to remember. Both the features of the skin, usually skin will be having subcutaneous fat and also hair, but here in these two regions we will not be having any hair or subcutaneous fat. So those two will be devoid of these two features. So about nipple and areola you might be clear, I think. Now we can move to the next topic, that is parenchyma. So in parenchyma we will be having glandular tissue which we are seeing in this picture. So in parenchyma, this is a cross-sectional picture what you are seeing. In this you can make out lobes, ducts, sinuses clearly, and these lobes and ducts together we are calling as glandular tissues. So about this glandular tissue if we are talking, it is arranged as 15 to 20 pyramidal lobes. You can make out in this picture, we will be having pyramidal shaped lobes which will be arranged as in rows. Okay, so it will be around 15 to 20 in number, and these lobes are arranged in radiating manner and it all converge towards the areola. It is coming from outside, from the lateral part as radiation, and then it is going to enter or converge into the nipple region through the areola. And these lobes are drained by lactiferous duct. Whatever secretion present in these lobes are getting drained into lactiferous ducts, and this lactiferous ducts at last going to pour out the secretion in the another part which we will call as lactiferous sinus, which you can make out in this picture clearly, I think. So we will be having these lobes as pyramidal lobes, and these lobes are going to secrete some secretion which is going to given to the ducts which we will call as lactiferous duct, and from the lactiferous duct we will be having sinus, that is an dilatation seen in the terminal part. So this dilatation we will call as lactiferous sinus. At last from the lactiferous sinus it is going to be poured into nipple region. And here you have to remember we will be having one important feature present in this glandular tissue, that is subareolar plexus of Sappi. So this is the plexus of lymphatic vessels which is seen below the areola region, which is going to collect the lymph from the areola and the nipple part. Then after it is going to drain it in lymph vessels, which we will deal later detailing. So now we are going to see about fibrous tissue. So about fibrous tissue, you have to know it is the tissue which is going to support the lobes and forms number of septa which is going to anchor parenchyma to the overlying skin and the underlying pectoral fascia. So from outside to the inner side, we will be having that grip made by this fibrous tissue which is going to support all the lobes together and by forming an septa. So number of septas will be formed by this fibrous tissue which is going to pull off the skin from the underlying skin till the pectoral fascia which is present posteriorly, till that this fibrous stroma is going to extend. And then these fibrous bands are called with a special name which we will call as suspensory ligament of Cooper. Suspensory ligament of Cooper are nothing but fibrous tissue of the mammary gland which is going to form septas inside the mammary gland. And these suspensory ligaments of Cooper, if a carcinoma is present, that is malignant cells, if it is present, it may extend along these ligaments and will produce some dimples of skin, which is again will cause some fixation of lump in the pectoralis major muscle. So this will form the malignant cells. What it will form is it will move along the fibrous tissue all over the course of fibrous tissue, and it will pull off the skin, which will cause, as a result, it is going to cause a dimple, and this dimple get fixed into the pectoralis major muscle, which will again cause an appearance of lump. So this is the important clinical aspect which is caused by this fibrous tissue malignancy. So cancer cells, if it is invading, it will cause this fibrous tissue to form lump in the pectoralis major muscle. Now talking about interlobar fatty tissue. So we have seen three parts about skin, parenchyma, and also about stroma. In stroma only, about fibrous tissue and the interlobar fatty tissue we are going to see. So this interlobar fatty tissue, this is the thing which is going to form the organ rounded in shape. The rounded contour what you are seeing is because of this interlobar fatty tissues. So this interlobar fatty tissues, it will be seen all over the mammary gland except two regions such as areola and nipple. So if you are seeing areola and nipple, you may not see any fatty tissues present inside it. So this is about the structural importance of mammary gland such as skin, parenchyma, and the stroma of the mammary gland. Now we will get into the structural differences which we are going to see in the mammary gland in stage wise. Okay, so now we are going to move on the differences, how it is getting developed. So first thing, from the birth to the prepubertal life of especially if we take in females, from birth to the prepubertal period, the lactiferous ducts are without alveoli. You can make out in this picture. So in the first picture, you can make out the lactiferous ducts which is radiating from outside to medial part. So these lactiferous ducts are seen only as ducts. No alveoli will be covering all these ducts. So this is a condition which is seen in the persons, like in children's and also in the women's, till the prepubertal period. So once puberty occurred, so at the time of puberty, the ducts form branching. So these are the things you are seeing which are forming branching appearance, and these peripheral branches form solid masses. So solid spheroidal masses of cells will be seen at the end of these branches. These are nothing but precursors of alveoli. So at the time of puberty, you will be seeing branching pattern. At the end of branching pattern, you can make out the spheroidal masses of cells, and those are again in later stages going to form the alveoli. So now coming for pregnancy time. At the time of pregnancy, further proliferation of all these masses will occur. So this further proliferation will cause alveoli. So number of alveoli will increase. So the increased number of alveoli will cause secretion of milk in the later part of pregnancy. So the in later part of pregnancy you can make out some fluid getting out from the nipple region. So that fluid is called as colostrum, which is very important to note it down. So colostrum, it is a milk which is secreted in the later part of pregnancy. So at the time of pregnancy, we will be having all these spheroidal masses giving rise for alveoli, and all these alveoli are going to start secreting the milk, and this milk at the later stage we will call as colostrum. And after lactation, what will happen is, once the lactation gets over, the thing happens is all this alveoli which is got formed during pregnancy will get shrink, and this shrinkend again forms the glandular tissue which returns to its resting condition as like before. So this is the fully formed lactating alveoli, and once lactation got over, all these alveoli will get regress and it will return to its original form. So this is all about the structural differences seen in the human growth of mammary gland. So that's all about the structural differences you have to keep in your mind, which we are dividing into 4 stages. So what are the hormones which are going to affect this mammary gland? So first we are going to see about hormone called estrogen, which is going to stimulate the growth and branching of the ducts. You might be knowing all these things. Again, we will brush up the estrogen. It is a hormone which is going to stimulate growth and branching of the ducts, and another hormone which is stimulating alveolar formation is progesterone. So these are the 2 important hormones which is going to play important role in the formation of mammary gland and its development. So estrogen stimulates growth and branching of ducts. Progesterone, it stimulates alveolar formation. And then we will be having estrogen and progesterone in the placenta, which is again forming the true secretory alveoli during pregnancy. The placenta again will give some estrogen and progesterone. Those hormones, it is important for the alveoli secretion during pregnancy time. And then we will be having prolactin and GH, that is growth hormone, which is important for maintaining lactation. So prolactin and growth hormone again is used in mammary gland for lactation, and another hormone oxytocin, which is important for milk ejaculation. So oxytocin, it is a hormone which is responsible for milk ejaculation. So another hormone which we are going to see is maternal estrogen. So if you are seeing about maternal estrogen, it is the hormone which is going to stimulate the duct epithelium in neonates, and it will secrete the witch's milk. So neonates, there again will be having some amount of milk produced, so that milk will be called as witch's milk, which is produced by maternal estrogen. These all about the hormonal effects present in the hormonal effects which is going to cause some changes in the mammary gland. Now talking about the anatomical feature again, about the arterial supply of mammary gland. The mammary gland, how it is getting arterial supply is by mainly means of 3 arteries. So you know, in this picture you can view, we will be having again a mammary gland with 3 important arterial supply to this. So laterally it is supplied by branch coming from axillary artery. So the axillary artery's second part, that is the part which is covered by pectoralis minor muscle, it is going to give a branch called lateral thoracic artery. So this lateral thoracic artery, otherwise known as lateral mammary branches, it is going to supply whole of the lateral part of mammary gland. So this is about the arterial supply seen in the lateral part of mammary gland. And second artery is perforating branches of internal thoracic artery. You can make out an artery here in the lateral border of sternum. Here you will be having a sternum, and the lateral border of sternum you may make out one artery present here. So this artery, which is coming from the subclavian artery, it is giving some branches at the level of intercostal spaces of second, third and fourth. So these arteries are called as perforating branches of internal thoracic artery, which again called with the special name called internal or medial mammary branches. So lateral mammary branches are branches which is getting bloods giving or it is a branches coming from lateral thoracic artery. Medial mammary branches are the branches coming from internal thoracic artery, that is perforating branches which is going to supply the second, third and fourth intercostal space. And another important artery which is going to supply the upper part of the mammary gland is superior thoracic artery. It is again a branch of axillary artery. So major two arteries which is giving supply for this mammary gland are, one is axillary arteries branch, another one is subclavian arteries branch. Axillary arteries branch such as two, one is superior thoracic artery, another one is lateral thoracic artery, and then we will be having internal thoracic artery, a branch of subclavian artery. It is giving medial mammary branches. That's all about the arterial supply. And another important thing, these are the features which we see superficially. The deep surface of the breast again getting blood supply from second, third and fourth intercostal arteries, but from lateral branches. So lateral branches of second, third and fourth intercostal arteries are going to supply deep surface of the mammary gland. The superficial surface is supplied by those three arteries such as lateral thoracic, superior thoracic and the intercostal arteries perforating branches and such as second, third and fourth. And now we are seeing deep surface. The deep surface is supplied by again second, third, fourth intercostal arteries but lateral branches. That's all about arterial supply you have to keep in your mind. Now going for picture, you can make out mammary gland here, and this mammary gland again will be having lateral thoracic artery arising from the axillary artery which is giving whole branches here. All these branches are called as lateral mammary branches. Same way you can make out in the medial side. This will be sternum. On the lateral border of sternum you will be having many branches arising. Those are nothing but intercostal arteries perforating branches which are called as internal or medial mammary branches. And this is a picture of venous drainage. The accompanying veins of the arteries which we seen are going to drain the venous part of mammary gland, which we will see now. This venous drainage again by means of axillary vein and the internal thoracic vein. We will divide into three parts such as upper part, medial part and lateral part. So we will be having lateral part and lowermost part are getting drained into same vein. So we will be seeing some plexus seen in the areolar region. We will be having nipple in the center part which is surrounded by areola. Below the areola we will be having some plexus formed. So that plexus we will call as circulus venosus. This circulus venosus which is seen in areola, it is going to again collect the veins from the nipple and areolar region, and these veins we will divide into superficial and deep veins. Superficial part, that is nothing but superficial area of mammary gland, are getting drained into this plexus, and these veins from these plexus are going to radiate to the peripheral part. Later it will drain into axillary vein laterally and medially into internal thoracic vein and into intercostal veins. So you have to remember we have three vein drainage. One is medial part, it is going to internal thoracic vein, lateral part going to axillary vein, and the medial uppermost part which is getting drained by intercostal veins. So we will be having circulus venosus which is present in the areolar region. So areolar region is the part. So areolar part, this is a region which is having circulus venosus, and from the circulus venosus all veins are getting drained in the lateral part. This is the lateral part into axillary vein, and in the medial part into the internal thoracic vein, and in the upper part it is going to drain into intercostal vein, and from the intercostal vein it is going to drain in ascicus vein, and through the asagus it is getting a communication to the internal vertebral venous plexus. So this is an important feature you have to remember, because whatever carcinoma happening in mammary gland, it will be getting transmitted into the vertebrae also. So they may communicate with internal vertebral venous plexus, which is called as plexus of Batson, through this intercostal and asagus vein. So because of this, breast cancer may spread to the bones very easily. That's all about venous drainage you have to know, and it is a very important thing you have to remember. About arterial supply, I will summarize now. Arterial supply, it is mainly by means of three veins. One is superior thoracic, three arteries: superior thoracic artery, lateral thoracic artery, and internal thoracic artery, which is giving its branch through perforating branches of intercostal arteries. Now we are talking about venous drainage. Venous drainage, it is going to form a plexus first in the areola, and from there the veins which are drained are again radiated on all directions, such as laterally it is going to get drained in axillary vein, medially it is getting drained in internal thoracic vein, and in the upper part it is getting drained into intercostal vein. This much you have to remember for your arterial and venous drainage. Now we will move on to nerve supply. So nerve supply, it is very easy to remember. It is by means of anterior cutaneous and lateral cutaneous branch of intercostal nerves from 4th to 6th intercostal space. So from 4th to 6th intercostal space, we will be having 4th to 6th intercostal nerves, which is having again two branches, such as anterior and lateral cutaneous branch, which is purely supplying the mammary gland. So anterior cutaneous and lateral cutaneous branch of 4th to 6th intercostal nerves are going to give nerve supply for this mammary gland. Now talking about lymphatic drainage, which is a very important topic for your exam purpose. Lymphatic drainage, it is again divided into superficial and deep, or else you can remember like we will be dividing as skin region or integumentary part and the parenchyma part. Both will be having different types of or different set of lymphatic drainage. We will move on to it. So this is an importance to surgeons, as cancer spreads mostly along these lymphatics. That's why it is considered as a very important topic you have to remember well. So it is very important because the cancer cells whatever present in the mammary gland will be spread out to other regions by means of this lymphatic vessels. So again we are dividing into two. So that is lymphatic vessels, which again divided into superficial lymphatics and deep lymphatics, and we will be having lymph nodes at last where all these lymphatic vessels get drained. So lymph system of mammary gland we are going to see by lymphatic vessels, and these lymphatic vessels how it is getting drained into lymph nodes present surrounding this mammary gland. So we can move on to superficial lymphatic vessels first. So superficial lymphatic vessels, it is going to drain skin over the mammary gland except the nipple and areola. You have to remember skin is a region which is getting including areola and nipple, which you know already. But for lymphatic drainage, we are going to exclude those two parts because those two will be having different lymphatic drainage compared to skin of other areas of mammary gland. So superficial set, that is including skin region, it is going to get lymphatic drainage in a different way compared to parenchyma. So this parenchyma part of the mammary gland, it is going to drain this areola and nipple part lymphatic vessels also. This thing you have to keep in your mind. So it is going to drain skin over the breast except nipple and areola. And how it is going to drain? The lymphatics pass radially, that is laterally, to surrounding lymph nodes. Whatever lymphatics present in the skin region are going to pass laterally or radially surrounding the lymph nodes, okay, to the surrounding lymph nodes. And the outer part which is getting drained into axillary lymph nodes, the upper part which is getting drained into supraclavicular or some apical lymph nodes, and then we'll be having inner part which is getting drained into parasternal lymph nodes. Then we will be having lower part which is getting drained into subperitoneal plexus or subdiaphragmatic lymph nodes. So these things you have to remember. Again, I will show a simple diagram which will be easy to remember. So this may be little confusing for you, but it is a very important and easier topic if you understand it well. So we are dividing the integumentary part of the mammary gland into 4 sections. So about the drainage of superficial set of lymphatics of mammary gland, we will let's see an very easy image to remember the superficial drainage, that is on the skin of mammary gland, how it is happening. So if you take, you will be having mammary gland, and this mammary gland will be having areola in the middle part. Now we are going to divide this mammary gland skin area into 4 parts for its superficial drainage. That is, one will be apical region and another one we are dividing into medial and lateral part. So this will be considered as lateral area, and this is apical region, and this will be medial region. So again, medial region we will divide into 2 parts, that is upper medial and lower medial part. So now these 4 regions of the skin of the mammary gland is getting its drainage in different way. That is, now coming about apical lymphatics, how it is draining. Above the mammary gland, if you make out, you can see a bone called clavicle. So we'll be having clavicle bone which is seen above the mammary gland near to the neck region, which we will also call as collarbone. And here we will be having some group of lymph nodes present above and below the clavicle. Same way, in the medial side of mammary gland, we will be having one bone which we will call as sternum. So this sternum again will be having lateral border which you are seeing here, and here in the lateral side of mammary gland we will be having axillary region, again that will be having some group of axillary lymph nodes. Now below the mammary gland, what you will see, you will be having, just remember this as right mammary gland, so we will be having right dome of diaphragm present below the mammary gland. Just below the right dome of diaphragm, we will be having important organ of abdomen, that is liver. So liver will be seen just below the right dome of diaphragm, and below the liver we will be having some collection of lymph nodes present just below the hepatic region. Same way, near to the midline part, that is near to the sternum, lower part of sternum, we will be having one muscle present. So that muscle we will call as rectus abdominis. So this muscle will be seen just below the lower part of sternum, which we will call as rectus abdominis. Again, here we will be having some collection of lymph nodes seen in the anterior aspect of this muscle. So these are the lymph nodes present surrounding the mammary gland, and these are going to be responsible for the lymphatic drainage. The lymph nodes which is present just above the clavicle, we will call that as supraclavicular lymph nodes. Supraclavicular lymph nodes are seen just above the clavicle. Same way, we will be having another set of lymph nodes which is present below the clavicle. We can call that as infraclavicular lymph nodes. And then we will be having lateral border of sternum. Again, there will be some collection of lymph nodes present which we will call as parasternal lymph nodes, which is present on either side of the sternum. So we are calling with a name called parasternal lymph nodes. Same way, here we will be having axillary region. So in that axillary region we will be having group of lymph nodes which we will call as axillary lymph nodes. So these are the lymph nodes seen surrounding the mammary gland in the upper part near to pectoral region. If you come below region, that is below the diaphragm, we will be having liver, and those lymph nodes which is related to liver we will call as hepatic lymph nodes. So this will be called as hepatic lymph nodes. Same way, In abdomen we will be having one covering called peritoneum. So inside the peritoneum, near to the anterior aspect of rectus abdominis muscle, we will be having group of lymph nodes, which we will call that as again peritoneal lymph nodes. So we can call that as retroperitoneal or subperitoneal lymph nodes. So that will be again present near to the anterior aspect of rectus abdominis. So we already had divided the mammary gland, the skin of the mammary gland, which is divided according to their superficial lymphatic drainage into 4 parts. So now we are going to see about the apical drainage. The apical part of mammary gland, it is getting drained in two regions, that is supraclavicular nodes and also in the infraclavicular nodes. Now talking about lateral aspect, this lateral aspect, the whole region is getting drained into axillary lymph nodes. We have seen axillary lymph nodes. We will see detailing about axillary lymph nodes later, and now we will see the upper medial aspect. Upper medial aspect of mammary gland getting drained into this parasternal lymph nodes, and then we will be having lower medial aspect which is getting drained into subperitoneal lymph nodes, and from the subperitoneal lymph nodes the lymphatics are again dispersed to many areas in the abdomen. One such area is hepatic area. So in hepatic lymph nodes also it will get drained. Along with that, it is going to get drained in ovary part, and this is an important thing. If it is getting drained in ovary, if any infection happening in mammary gland such as carcinoma, that will lead to drainage or dispersed in ovary region. So that time we will be having one condition called Krukenberg's tumor. So about this again we will deal later. So this is a tumor which is occurring in the ovary of females due to the spread of carcinoma from the mammary gland. That's all about the superficial side drainage of mammary gland, which you have to remember. So now talking about deep lymphatics. So deep lymphatics, it is going to get drained through the parenchyma of the mammary gland. So this parenchyma of mammary gland getting drained into 3 groups, especially in the axillary lymph nodes and parasternal lymph nodes and in the intercostal nodes. So that's all about the deep lymphatics. The main thing is parenchyma including the areola and nipple. Usually in skin region what we seen is it is excluding the areola and nipple. We seen it is divided into 4 regions, and those how it is getting drained we have seen. Now we are going to talk about deep lymphatics where parenchyma getting drained along with areola and nipple part. So now we know we will be having axillary nodes. So that is the important node which is going to drain 75% of the lymphatics from the parenchyma, and remaining 20% is getting drained by internal mammary nodes, and then we will be having 5% getting drained into posterior intercostal nodes. These are the distribution of lymphatics from the parenchyma to the lymph nodes. Some lymphatic vessels from the deep surface pass through the pectoralis major and clavipectoral fascia to the apical nodes, and then it is getting drained into internal mammary nodes. So these are the things you have to remember. Deep lymphatics by means of 3 nodes it is getting drained. One is axillary, internal mammary and posterior intercostal nodes. And now we have to talk an important topic, that is subareolar plexus of Sappi. Already we have seen circulus venosus, a plexus which is seen in the areola part. So that is again getting radiated and draining into particular veins. Now here for lymphatic also we are having some type of plexus. That plexus we will call as subareolar plexus of Sappi, which is seen in the areola. Again, this subareolar plexus importance is this plexus of lymph vessel which is present deep to the areola going to collect the lymph from areola and nipple region, and then the subareolar plexus of Sappi. These are the plexus which is seen in the areola, same like venous plexus which we seen before. The venous plexus which is seen in the areola region Again, it is going to radiate and getting drained into different veins. Here also it is present in the areola and it is going to drain especially nipple and areola region. Then after, it is going to drain those lymph in the anterior axillary lymph nodes. So that's all about the lymphatic distribution, about the lymphatic vessels, how it is getting drained into lymph nodes surrounding the mammary gland. Now we are going to talk about lymph nodes which are seen surrounding the mammary gland. Those lymph nodes are again axillary lymph nodes, which we already dealt. This axillary lymph nodes which is present in axilla again grouped into 5. That is, one is anterior or pectoral group, another one is posterior group, then we have lateral group and central, along with apical group of axillary lymph nodes. You can make out in the picture clearly. So if you are seeing in picture, we have apical lymph nodes which is seen above, that is just near to the clavicle region. Then we have central axillary lymph nodes in axilla center region. Then we have lateral axillary and anterior, which is seen near to the pectoral part. Then we have posterior axillary lymph nodes seen near to the posterior axillary fold. Then we have you have to remember all these lymph nodes receives lymph from breast either directly or indirectly. It may pass through some other lymph nodes and later it may enter into the lymph nodes of axilla. So that's all about the lymph nodes of axillary region. You have to remember all the 5 groups: anterior, posterior, then central, along with apical and lateral group of lymph nodes. Another important lymph nodes which we seen before is internal mammary nodes, that is nothing but parasternal nodes, which is present lateral to the or lateral border of the sternum. So this is again present related or corresponding to the internal thoracic vessels. These are things you have to remember for lymph nodes. So I think lymphatics of mammary gland is clear to you. You have to divide into 2 sessions, that is lymphatic vessels and lymph nodes. And about lymphatic vessels, while you are explaining, you have to tell about superficial set and deep set. About superficial set, excluding areola and nipple, only the skin area surrounding the mammary gland. And about the deep set, you have to talk about parenchyma lymphatics along with the areola and nipple region. The important thing you have to remember is subareolar plexus of Sapi, and then you have to move on to lymph nodes, how it is arranged. We have important 2 lymph nodes, axillary and internal mammary lymph nodes, and about axillary lymph nodes, all the 5 groups you have to explain out. So again, some other lymph nodes also you have read, especially in the lymphatic vessels. While we are dealing, we have seen some other lymph nodes also. Those are nothing but supraclavicular lymph nodes, which is present above the clavicle. Then we have cephalic lymph node. You may know deltopectoral area is a region which we seen in upper limb between the deltoid muscle and the pectoral muscle. So that region also will be carrying some lymph nodes, which we will call as cephalic nodes or deltopectoral node. Then we will be having posterior intercostal node, which we seen while talking about superficial set of lymphatics. So posterior intercostal node is another type of nodes which is going to drain mammary gland, along with subdiaphragmatic nodes, which is draining the lowermost part of the skin area. Then we will be having subperitoneal lymph plexus, which is again giving the lymphatic vessels again to hepatic and to the ovary regions and all. Okay, all about lymphatics we have cleared out. All these lymph nodes names you have to remember. Now going for axillary lymph nodes in bit detail. As I said, we have 5 groups of axillary lymph nodes. Mostly all lymphatics end into the anterior group. Compared to all other group, major part of the mammary gland are getting entered into anterior group of axillary lymph nodes, and some partly into posterior and apical group. And from this anterior and posterior, these lymph nodes which got drained again will give some lymphatic vessels which will again drain into lateral group. This lateral group again drains into apical supraclavicular nodes. Apical group, then after it is going to drain in supraclavicular nodes. And later all these nodes at last going to enter into thoracic duct in the left side and in the right lymphatic duct in the right side. So at the terminal part, these lymphatics which is collected from mammary gland after reaching the axillary lymph nodes, at last it is going to enter into the thoracic duct in the left side and in the right side to the right lymphatic duct. That's all about the termination. Internal mammary nodes are the nodes which is going to drain both inner and outer half of the mammary gland. That's all about lymphatic system seen in the axilla. At last, how it is getting entered into thoracic duct and right lymphatic duct, you have to explain out. Axillary lymph nodes, 5 in number. We have anterior, posterior, apical, central and lateral group, and these groups after collecting the lymph from mammary gland, again it is going to pour out the lymph into the thoracic duct and right lymphatic duct. Later, you have to mention a point about the internal mammary group which is again going to drain both inner and outer half of the mammary gland. Now coming for clinical aspect, you might be heard a word called Krukenberg's. If you have not heard, fine. Just to remember, a tumor is there which we will call as Krukenberg's tumor, which is going to affect in female reproductive organ, that is ovary. That is formed mainly by cancer cells which is getting spread to subperitoneal plexus. Again, from subperitoneal plexus, some cancer cells got dropped into general peritoneal cavity and produce secondary deposits on the surface of ovary, which we will call as Krukenberg's tumor. You can make out in this picture the ovary, it is got affected by tumor cells, so we are calling this condition as Krukenberg's tumor. You know, we have skin region where lymphatics from skin in the medial aspect lower part getting drained into subperitoneal plexus. This subperitoneal plexus, again it is going to radiate all these lymphatic vessels to many parts, and while radiating some cancer cells from the mammary gland, it will again deposit in the secondary areas such as ovary, and that condition we are calling as Krukenberg's tumor, which is very important for your exam purpose. And this tumor have worse prognosis. Now moving to development of this mammary gland. Moving to the development, you can make out here in the intrauterine line how it is present. In 6th week intrauterine life, we have only a small elevation. Then after we will be having the duct system developing. Later we have the alveoli formation, duct system getting more developed. Then we will be having alveoli formation. So now we will move on to the major developmental part, that is embryological part of mammary gland. You can make out in this picture so many lines are there with dots, right? That is nothing but milky rich. We will call that as milky rich. So you have to remember the development of mammary gland is mainly by two sources. One is by ectoderm, another one is by mesoderm. The surface ectoderm, it is going to give rise for epithelial lining of duct and alveoli. We have two sources for this mammary gland development. One is surface ectoderm, which is giving epithelial lining of ducts and the alveoli, and then we will be having mesoderm, which is going to develop fibrofatty stroma. Then if you are talking about the how it is present, if you are seeing in this picture, you can make out the origin of mammary gland in many areas. How it is fixed in a pectoral region. In 7th week of intrauterine life, the milk ridge appear on each side of the ventral body wall from axilla to the inguinal region. See, in intrauterine life at the 7th week, we have this milk ridge starting from axilla to the inguinal region. Later what will happen is, in humans it persists only in pectoral region, which is going to give rise for this breast tissue. Later, this all the other things which is present from the axilla to the inguinal region other than pectoral region will get regress. So only thing which is present in the pectoral region will stay, and that again will develop the mammary gland later. So development of mammary gland is very easier. It is developed by two parts. One is by surface ectoderm, another one is by mesoderm. Surface ectoderm, it is giving rise to epithelial lining of duct and alveoli, and mesoderm giving rise for fibrofatty stroma. And in intrauterine life, at the 7th week, it is going to form milky ridge on the either side of the ventral body wall from axilla to the inguinal region, where only the development seen in the pectoral region, all other things will get regress. That's all about the development you have to know. And you can make out, yes, axillary tail, right, which we seen before. That axillary tail is nothing but cephalic end of the milky ridge. So the milky ridge formation will be having cephalic end, that is nothing but the axillary tail of Spence, what we are seeing. Now coming for the size of this mammary gland. In male and in immature female, it is rudimentary. You can make out, you will be seeing only the nipple and areolar part. Nipple is small and areola is fully formed usually, and then once puberty occurred, it will be well developed. Later during pregnancy, it becomes more marked. Then at the time of pubertal growth of female breast, it is visible externally. That condition we will call as thelarche. So thelarche, it is a condition where externally visible post pubertal growth of female breast will be seen. So that's all about the size of the mammary gland, which is rudimentary before puberty, and after puberty it is well developed. While talking about the male mammary gland, that is male breast, it will not be having any alveoli. The duct system present in the male breast will not be having any alveoli, and it is supported by fibrofatty tissues. And the condition which will be having appearance same like female mammary gland, we will call as gynecomastia. That is nothing but bilateral hypertrophy of male breast, which is not seen in normal human being or normal male structures. So the cause of this gynecomastia is Klinefelter syndrome, which is an endocrine disorder or impaired liver function. These are the reasons which will cause the gynecomastia condition in males. Sometimes we will be having carcinoma in males also, but the case will be very severe compared to female carcinoma. The prognosis of carcinoma of male breast is worse than that of female carcinomas. And other congenital anomalies related to this mammary gland are amastia. Amastia, it is in the sense it will indicate agenesis of breast. So breast will not be present. That condition we will call as amastia. Polymastia, it is a condition where accessory breast along the milk ridge will be seen. We have already seen in development of mammary gland, there will be a milk ridge extending from axilla till the inguinal region. So along this milk ridge, if more than one mammary gland is developed, in that condition we will call as polymastia. And another condition we will call as athelia, where absence of nipple will be seen. So the whole of the mammary gland, if it is present, we will call as amastia, and the absence of nipple alone we will call as athelia. The another condition we will call as polythelia, where supernumerary nipples may be found along the milk ridge, which you can see in the second picture. So first picture what you are seeing is amastia, the person with one-sided mammary gland, and the second condition in second picture what you are seeing is polythelia condition, where supernumerary nipples will be seen along the milk ridge. And now we will see other applied aspects related to this mammary gland, that is clinical anatomy of breast, especially carcinoma. Infiltration along the ligament of Cooper and pectoral fascia, that is due to fibrosis, will lead to retraction of skin, fixity of breast. The carcinoma, it is going to make the infiltration along the ligament of Cooper and also the pectoral fascia, which will lead to retraction of the skin and got fixed into the pectoral fascia. and it again causes extension along the lactiferous ducts. The carcinoma will extend along the lactiferous duct, which will again cause retraction of the nipple region. Then another condition what you are seeing is POD orange, that is due to obstruction of the cutaneous lymphatics and edema of skin around the hair follicles. It is a condition where cutaneous lymphatics will be obstructed, which will again cause edema in the skin, which is present around the hair follicles. So all the hair follicles seen in the mammary gland will get retracted, which will give an appearance like orange. So we are calling that as POD orange condition. And you have to remember there is about 60% of carcinoma occurs in supralateral quadrant. We have divided the mammary gland according to lymphatics. Same way, if we are dividing into 4 quadrants, the supralateral compartment or quadrant is more prone for this carcinoma in 60% of cases. And other applied aspects are the incision. If it is made in mammary gland, it should be made radially to avoid cutting the lactiferous duct. The incision which we given in first picture is the right one to make. And the important thing what you are seeing in the second picture is breast abscess. It will occur normally in more number of females. So the abscess will get collected in the breast region, we will call as breast abscess. And for viewing the conditions related to mammary gland, we will be having an instrument which we will call as mammogram. So it is a mammogram which is going to give us the results of the mammary gland appearance, how the glands ducts are developed. So you can make out 2 pictures here. The normal picture which is seen in the first area or towards the left side, where no important features will be seen. If you are seeing the tumor condition, there you can make out a lump of cells collected in the mammary gland. So that is the main cause for carcinoma of mammary gland. That's all about the class about mammary gland.